After spending 2 weeks at home, most kids are heading back to school Monday, ready to tell their friends all about the holidays. Some kids are carrying new toys they got, but some are carrying anxiety with them. Belmont Pines' lead social worker and counselor, Christine Laposa, joins me now to discuss how to deal with anxiety after a long winter break. Christine, thanks for joining me.
Yes, thank you for having me.
So kids have spent the past 2 weeks at home, probably sleeping in, surrounded by their parents. When heading back to school, what are some of the biggest anxiety-inducing things that you hear kids concerned about?
Sure. Over the years, we have certainly noticed trends here at Belmont Pines, especially the increased number of youth that are referred to us by schools, families, our community partners right after that back to school return following winter break. There are lots of different factors that can contribute to this, especially in coming back after a long break. So first of all, kids are returning to school and they are returning to an environment of routine, structure, and increased responsibility. Over the break, many of our kiddos prefer to stay up late, sleep in late, have more downtime to relax, use electronics, socialize, or do other preferred activities, and not as many of those academic pressures. However, when they're returning to school, that means adjusting their body's natural rhythms to match the school schedule. It means less time to rest and relax and do things they enjoy, and pressure to perform in the classroom.
Christine,
another thing can, yes.
What are some coping mechanisms children can use if they're feeling anxious?
Absolutely. So to speak to the idea of routine, keeping a consistent routine and structure throughout the winter break that's at least somewhat similar to the school year can help, or gradually and very intentionally transitioning back into that routine as they're getting ready to head back to school. This can minimize the risk of kids becoming dysregulated and having to make sudden dramatic changes in their daily rhythms.
Is there a way to help identify what might trigger anxiety and maybe create a plan before it overwhelms you?
Absolutely. So some of those signs and symptoms I mentioned earlier are good ones to look out for. Kids who tend to worry in excess of what might be typical or expected. Also things like people who may be kind of on edge, not be able to focus, maybe be a little bit more easily irritated or annoyed by things, or appear overly tired or exhausted. You can also notice kids in their social environment. So another stressor for kids is returning to challenging social situations at school. So some of our kids enjoy being in the school setting and get along well with their peers, but others have a different experience. Maybe they don't have as developed of social skills. Maybe they don't have a sense of belonging, or in the extreme form, maybe they're even victims of bullying. So these are things that we can look for. And as kids are coming back from winter break, returning to these social stressors, they may be anticipating that stress and become overwhelmed by that.
If parents are seeing something in there, they feel like, you know what, we need to get some help. What's your best advice for them?
Yeah, I think a combination of using healthy coping mechanisms, that can be everything from sensory grounding techniques to expressive arts methods, music, dance, visual art, movement-based activities, getting out some of that extra anxious energy in constructive ways, helping them to learn the social skill of setting and practicing healthy boundaries, and having supports to talk to, whether that's school staff, counselors, things like that. And of course, we at Belmont Pines are one of those resources. So here we are a behavioral health hospital that serves children and adolescents with mental health challenges. We have an acute inpatient, a residential treatment, and a psychiatric residential treatment level of care. In addition to that, we have both group and individual services, therapeutic and psychiatric, and we also help connect others to different types of care in our community. We're trauma informed, take an interdisciplinary approach, and use individualized care to meet the unique needs of the children and patients we serve. Yeah. We also have a 24/7, 365-day a year walk-in assessment. And if our services aren't the right fit for you, we can refer you to other types of care in the community.
Yeah, it's a great resource. Christine, thanks so much for joining us. We appreciate it.
My pleasure.